sort of thinking about this partnership between the fetus, the mom, the partner. Are there any other partners in this? Because we tend to think of the mom and we tend to think of the fetus.
Right. No, that's so interesting. And the newness of this research, I also would really like to highlight because I think it's so important we've gotten there. In terms of other partners, absolutely. And in fact, one of the risk factors that comes up sometimes, not all the time in research, but I think there's a signal there, is the woman's relationship with her mother. And that is for psychological reasons in terms of we know very well from research, in fact, from Ruth Feldman, whom you know well, that we carry with us these psychological templates of relationships starting from very young. And we use them as assumptions about how we're going to get along with people. Are we going to be loved, not loved? How are you going to treat me? And these get activated when we're anticipating having a baby. And, are we going to go back to a faulty template that love doesn't happen, it doesn't go well, or maybe things have intervened and we're able to say, I'm going to do it differently with my baby.
So let me ask you, so that's interesting. Is it because of the lifestyles have changed over decades in terms of the organization of families? It's much more common now for the mother and her mother not necessarily to live
near each other.
together,
Yeah.
or live near each other. So, so what are you recommending?
Well, and you're absolutely...
Should they be together?
Yeah,
Or
exactly.
should they be apart?
You're touching on exactly both parts of this. So one is, where am I in terms of my template about relationships, and have I resolved things with my mother? How am I going to be with my baby? What's my foundational assumptions about relationships? The past comes back when you're having a baby. And so if things have been resolved, it's like, my mom really wasn't able to be around, but now I understand she was juggling a job and going to school, and I've gotten over it. So it's great to have her around. And does she have a lifestyle where she can come be with me for 6 weeks? Because that's hugely helpful. Or is it a bad thing to have her around? So there's the psychological aspect of the quality of that relationship. And then, frankly, there's just needing another set of hands.
Yeah.
And I sometimes, with women, will try to understand the relationship, and we'll get to a point with one of my patients where we realize it's better for her to have a doula, for having someone paid to be in the home, because the relationship with her mother is so fraught. But there is the logistics of need for another person to be around.
So let's talk about the partner now.
Yep.
As the second component of this triad.
Right. And again, I think that can be complicated because at times they're dealing with their own, stressors around this anticipated baby. Yeah, exactly. It's a whole role change for the partner and for all of it. But being willing to observe the woman and check in with her, and how are you doing? And I will say that in terms of my clinical practice, when there's a woman, when a man will sometimes call up, and I've had this with men, I just haven't happened to have it with a gay partnership, where a man will call up and say, I'm really worried about my wife. And what we've worked out in our practice at Columbia is that we want the person who's on the phone taking that call to actually have some expertise in, because you need to ask them that, because it's a lot of a burden for an untrained person to make a differential of how concerned should we be. And so we want to know, is she talking about death all the time? I mean, how bad is it? There are signs of risk for suicidality. We need to know that. So the man, the partner, having the courage and the commitment to make a call, to be aware of how the woman is doing, to just notice change. And it may be, we would say, oh, this is the usual stressor. This is a major thing, but great you kept in touch. Or get her in right away.
So encouraging a partner to make that call, and then even if things are okay, and this is just something that normally will occur, encouraging the partner to say, that was a good thing, and if anything else comes up, don't be shy to make the contact. So that's great advice.